FY2 in GP. Patient is Mrs. White, age 27. She's come to you because she's worried about inheriting Huntington's disease. Her mother has been diagnosed with this, and what you need to do is talk to her and address her concern. Okay, so that is what is our concern. She's worried about Huntington's. So what do we know about Huntington's? So I've put a mnemonic actually for you guys. It was available online. So Huntington's, what happens in it? Huntington's, this is a mnemonic. H is hyperkinetic move. So you'll see the patient might have chorea, tics. So these kind of movements, involuntary movements your patient might have, right? U is unsteady gait. So they will have the problem with the gait, problem with the coordination. Then they might have neuropsychiatric problems like depression. So what you can do, you can ask questions for depression as well. Again, the same thing I'm going to repeat. So mood, you can ask for anhedonia, you can ask for sleeping, you can ask for eating, you can ask for suicide as well. So all those questions you can ask. Trigger. So what are the trigger factors? The thing is Huntington's, you are, if your mother has it, you are having 50% of chances having it because of because of its nature. It is autosomal dominant. I'll come to it. So what are the trigger factors? The trigger factor can be stress, right? And the age your mother got this Huntington's, it's not like you are also gonna get in the same age. So it can be different for you as well. So if you are having a work which is like too much of stress and all, so you may get it early as well. So that's how it is. Yeah. Impaired cognition, so they may have memory loss as well. They might have an nystagmus, abnormal eye movements as well. G, it is a genetic, it is autosomal dominant. T is 30 means it happens usually in around 30 years, 30 to 50 years, that's what you can say. Over time, it can get worse. It can lead to weight loss, and the main thing is dysphagia. So that's why you will see in the advanced stages of Huntington's, the patient, they will be needing too much of support in terms of eating, in terms of tube and all, because in later stages, over time, it's going to get worse and it's going to cause severe dysphagia as well, right? And it's no cure, but we can manage the symptoms over time. That is the main thing. So this is, if you know this Huntington, you will be able to manage this scenario. Okay, so let's have a look what exactly they are expecting from us in this particular scenario. So you are in GP, Tracy is 27, has come to you because she's worried about inheriting Huntington's because her mother is a diagnosed case of it. Okay, so how can I help you? I'm worried I might inherit Huntington's because my mother has it. Okay, so what you need to know now here is, I'm sorry to hear about your mother, how your mother is doing at the moment, and if she's okay or not, and at what age she was diagnosed, because that is really important for us, right? So now what we're doing, we're checking her understanding. How much do you know about Huntington's? Tell me more about your mother's diagnosis, when she was diagnosed, how is she being looked after, what kind of treatment is she getting, and how is she now? So that is the thing, these are the things you need to ask, right? So what do you know about it? And what is your mother's status when she was diagnosed, which symptoms she had, what kind of treatment she's getting, is she okay or not? So show some empathy for her as well. Now, what you need to do, she's 27, and we know it can happen in somebody somewhere at like 30 years. After 30 years and all, it can happen. And if the mother has Huntington's, there are high chances she might get it as well, isn't it? Because of its nature, isn't it? Because it is autosomal dominant. Yeah. So, for example, you can put it in this way. So we have got, say, father, and the mother has got Huntington's. Yeah. So what's going to happen? This is a normal child. This can have Huntington's. So this is a normal child, and this can have Huntington's. So this is father, mother. Mother has Huntington's, right? It's autosomal dominant. So there are 50% of chances the daughter, she can get Huntington's as well. That is really important. Her concern is valid. Her concern is valid. So even if you get a pen and paper, you can explain it in this way as well, right? So now what you can do is you can ask her some questions as well about Huntington's. So which questions you can ask? These questions you can ask. if they have got any involuntary movements, if they have got problem with the gait in walking, any problem with the coordination, how's her mood, sleeping, eating, suicide, stressed, what kind of work she's doing, if she's okay with her memory or not, any problem with the eyes and all. Ask those questions, the symptoms you can ask, right? So this is what I've tried asking here. If you've got any involuntary movement, change in your coordination, any difficulty with the memory, mood, you can ask all those things, right? Okay. So now she's worried that she might get Huntington's, but we have to be very careful. We need to do a bit of counseling for her kids as well. If she's in relationship, if she is having any kid, or she is planning to have kids or not. So we need to think about that as well. So that's what I want you to do is whom you are living with. If the partners are there, ask for children. That is very, very important. If there is a partner, if you have got kids or if you're planning to have kids, that's one. Another thing, if you have got any brother or sister from the same mother, I mean, if you've got any siblings. Because if the mother have Huntington's, there are 50% of chances the children will get Huntington's as well. So that's why you need to ask if there are any siblings and if you are having any kids or not. So this is very, 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 very important thing here. Okay, so what are we asking? We're asking about Huntington's, about the mother, what's happening with the mother, how is she now, which symptoms she has got, what do you know about Huntington's, if you have got any symptoms of Huntington's or not, who's there in your family, are you in a relationship, are you like any kids if you have it, or if you have got any siblings or not, right? Quick past personal history, because here you need to take proper psychosocial history as well, including stress, including job, what kind of job you are doing. Yeah. From the check vitals, do a general physical examination, it's a blood test, and mainly for genetic testing. That's the main thing. Huntington disease, it's a genetic condition, autosomal dominant, and if a parent has it, there is a 50% chance of inheriting the gene. However, not everyone with this gene develops symptoms at the same age or in the same way. So if the mother has got different symptoms, maybe the daughter can have different symptoms. Maybe mother had got it at the age of 40, the daughter can have it at the age of 50, can be there at the age of 30 as well. That is the main thing. Okay. So for genetic testing, refer to the genetic counseling to explain the process and support your decision. Regular checkups for physical and emotional support. Resources point to help with understand the condition better. Preventing inheritance options include genetic counseling, pre-implantation genetic diagnosis during IVF, adoption. Discuss it with your healthcare provider. Meaning, if she's planning to have kids, what we can do, we can refer her for genetic counseling, and they will be able to counsel this patient for more detailing, right? In terms of treatment, if you have to talk about, there is no cure, but the treatment can manage the symptoms and improve the quality of life. So medicines like antidepressants, mood stabilizer, or treatment for the involuntary movements. So the treatment is going to depend on which symptom the patient has got, right? For the daily task, use ramps, stair lift, grab rails, electrical aids, occupational therapy offers. Why? Because the problem is going to be with the coordination as well. So that's why. Eating and communication, not early, but in the later part of the later stages of this illness, it is going to give you dysphagia as well. So that's why you'll be needing the support for eating as well, feeding tubes and all. And movement, stay active, walking aids, fit therapy, and all that is quite helpful. See, the scenario is not about talking about the treatment. I have written the treatment here, but the scenario, you're not supposed to talk about the treatment of Huntington's, right? Because she's not having Huntington's at the moment. And even if you ask the questions to her about the symptoms of Huntington's, she's not having it. But she's worried, can I get it? So the answer is yes, you can get it. And there are high chances because of your mom having it, right? So 50% chances. So you can explain that. But then you will do the counseling as well, that it is not like treatable. We can't like cure, but the treatment is like we can manage the symptoms. We can improve the quality of life as well. And then you talk to her about the future as well. If she's planning to have kids, for that, what we can do, we can actually arrange a genetic counseling. So the counselor can speak to her and explain her about the pros and cons and what are the investigations and all genetic counseling we can offer her, right? And ask about if she has got any brother, sister or not. So these are the things that you need to cover. Okay. So that's the main thing. So treatment I have written here, but the station is not about the treatment. The station is about addressing her concerns about Huntington's. Right. So that's the main thing. And please remember this Huntington as well. Hyperkinetic moves, unsteady gait, neuropsychiatric problem like depression, triggers is like stress, impaired cognition, memory loss, nystagmus, abnormal eye movements. It is on genetic autosomal dominant, T is 30 to 50 years. That's the main age group. Over time, it gets worse, can lead to weight loss, can lead to dysphagia. That's the main thing. And there is no cure, but we can manage the symptoms. Right? So that's what we have got in Huntington's disease.